Okay, Dr. Morse, the recording is going and you can take it away.
All right, guys, I know this will be a whirlwind today, so I will get right to sharing my slides, hopefully. Okay. So as usual, this is for school staff and health department staff. So if you're not one of those, if you could pop off just so we can make sure to conserve our time answering questions, this will be recorded and placed on our website within a few days. So it will be publicly available. And make sure that you disseminate this information to other staff that needs it on the front lines. We sent out earlier this week kind of my translation of what the new orders meant for schools. Hopefully you got that. If not, let us know. But it was just basically, taking the wordings of the orders and translating it. So the links are here. One of them that has been brought up is really not a new order. It's from October 14th, and it's from the MIOSHA emergency rule, which is available on a different part of the state website. It's basically saying that in-person work for their employees, as long as their activities can be completed remotely. So basically, if, especially now that high school's remote, and if you have teachers or classes in quarantine, or if you have your K-8 remote, if your educators can do their work at home, they need to be doing their work at home. If you have support staff that can do their work at home, they need to be doing their work at home. And this is to help reduce risks of transmission. There is an FAQ about this as well on the MIOSHA website, and the link is here, further explaining this. So employers are obligated to demonstrate if remote work is not possible for those that are working in person. So if there are things they absolutely cannot do at home and must work in person, you have to demonstrate that in your written policy. If they're trying to use Zoom and they don't have internet at home, or if they're distributing lunches and obviously they can't do that from home, but you have to have documented proof as to why they cannot work from home if you're having them work from home. I am not an employment expert or a MIOSHA expert, but I'm just passing that along as we have had some complaints from a few different counties on this. So just know that this is the rule now. Also, there is a phone number here. This is on the MIOSHA website, but if you have questions, there is a phone number here. It's 855-SAFE-C19 that you can call MIOSHA and clarify any of these things. So the new order that came out on Sunday that was effective as of yesterday, the wording applicable to the schools is on the left, but basically 9 through 12, no in-person school through the 8th. So until the 9th, at a minimum, we'll see, if there's any extensions to that. We're not sure if that would happen or when they would announce that. Except for those who might need special education services. And we are trying to get some clarification on that, if that applies to like those in juvenile detention services and some other caveats that are a little unusual. So we know there are some questions about what all that applies to. And then people that are learning English as a second language. Students or individuals can also gather if you're providing them with food for students that don't have internet access, and any physical or mental health services. So if you have healthcare services within your building, and then childcare, and that applies to like in the spring, some schools provided organized, structured childcare for like healthcare providers that needed to work and didn't have other childcare services. So that's formal childcare services. Not letting employees bring children into work. That's formal childcare services. So those buildings can be repurposed for that if needed. In the K through 8 schools, sports and extracurricular activities are not permitted at this time at any grade level. But K through 8 in-person education is permissible. It's an individual decision-making at this time for those schools. And even if you do decide to go to remote-only education, all those other activities I just mentioned, special education, distribution of food, internet access, those things are all still permissible. In terms of the face masking, because this kind of replaced that whole order that was there before, the only thing that changed on the face mask order is it used to say that you had to wear a face mask at non-residential gatherings. Now it just says any gathering. So I don't think your family members are probably going to turn you in, but I mean, technically this is saying if you get together with your family members, you're supposed to wear a face covering. But that's just the only change that was on the verbiage for face mask requirements and face mask exceptions. The other thing is they did much more clearly define what a face mask is. So it's a tightly woven cloth or other multi-layer absorbent material that closely covers an individual's mouth or nose. So we've had questions, people wearing like mesh or lace face masks or shields that kind of lift up over the face. So this should give you more definition as to what is allowed as a face mask. Yesterday, they posted a frequently asked questions about the emergency order. The website is here. And again, we'll share these slides with you so you have all these links. But these are found on the same page as the epidemic orders are. But this first question, because the order says that you can accept a statement saying that someone can't wear a mask, does that apply to schools? They're saying, no, it does not. You still need to have a doctor's note saying that there is a medical reason they can't wear a mask. Do people have to wear it at all times in gyms? Yes, they do. This just is clarifying that yes, school or high schools can be open for people to get internet access, to get meals, to get medical care, but you can't have them open for gyms or extracurricular activities. And then clarification on the elementary schools and middle schools, as we just discussed. So those are available online now. Getting into our data, I kind of hustled and I pulled together a bunch of new data to show you today just to see if that's helpful. But this graph you've seen before, these are our cases in Michigan, unfortunately. So really just cranking up there. These are the total number of cases that we have had in the 3 districts that I cover, the 19 counties that I cover. So again, just still climbing up there. Looking at the number of cases that we've had in the 19 counties, and I do break it down into individual counties here in a minute for you guys. So hang tight. In the week between the 10th and the 17th, looking at cases that were reported to us during those dates. And when I say reported to us, that's when we actually got that information. They may have developed symptoms a week or 2 earlier. They may have gotten tested a week or 2 earlier, but those are the dates they were reported to us. So we had over 4,000 cases in those 19 counties. Just over 260 were in teachers or students. That was 6%. If you recall, we had 6% in each of the last 3 weeks that we've talked. The total numbers are increasing, but the ratio is staying the same. 26% of those 261 were in teachers, 74% were in students. 13% of all of our cases were associated with a school outbreak of one sort or another. I went back over the past 3 presentations I've given. Last week it was 12%, the week before it was 7%, and the week before that it was 10% were associated with outbreaks. The main issue we're facing right now, and we've talked about it before, is we are getting, as you can imagine, 4,000 cases in a week. And we have, I would say, probably 40, 50 people working on these cases, probably more than that. But, people just working 7 days a week on these cases. We are not able to investigate all these cases at this point, and we're doing the best we can, but we probably have about 50 to 70% of our cases where we don't have it recorded where they work, what their occupation is, if they go to school. We're trying to prioritize school-age children, but that's been a challenge, and more so just the people that are of working age. You don't know, are they a teacher or not? So we're really relying a lot more on our schools to notify us if somebody in the school is sick. So we'll talk more about that in a minute. So this is Central Michigan District Health Department. I had my nurses give me their data for the last week as best as they knew it at the time. And this was yesterday or the day before they got me this data. So this, oops, sorry. Trying to get my cursor. So this first column here is the number of cases that we've had in the last week in teachers. And then the next column is the number of cases we've had in students. And in hindsight, I wish I'd asked them to separate out K through 8 and high school, but hindsight's 2020. This third case is the number of cases that were associated with an actual in-school outbreak. And just for a point of consideration, we know there's been concerns about how long it's taking to get test results back. So I was just curious if they knew about how long it was taking for people to get their test results back. The total number of cases that county has seen in the last week, and then the percent of cases related to school in each county, and the percent that was an outbreak, a percent of their total cases that were outbreak related, school outbreak related. So you can see that some of our counties have had some higher numbers of cases, but they've had higher number of total cases. Osceola County, I just got their counts today and I didn't have a chance to follow up if they've truly had that many students that have been positive, but none of them were reported as part of an outbreak. But again, just trying to demonstrate what each individual county is seeing. And I can come back to this if you need more time to look at it. I will click on here though to District 10. So I know Newaygo County has had a bigger jump in student cases, but there have been no reported outbreaks, at least that I was notified of. And they've had some higher numbers of cases in the community overall. So their total number of school-related cases is on par, with the average elsewhere, but I know it's going up, basically. That's what I'm trying to say. This here should converted it to a date. This should be 4 to 7. I apologize, I didn't catch this. I was really hustling to get this done because I wanted to add this info in for you to see more specific for your counties. This is really busy. And again, we're going to send this to you, you can have it, but this is all available on the website. They started listing all of our hospitals now, not just the systems, but this is the status of our healthcare systems. So some of our hospitals, like our little one in Standish, are saying that all of their beds are full. Gratiot reported that all of their beds were full. This was on the 16th. I was just on a regional healthcare call earlier this morning, and they were talking about how busy it's been, but they still have ventilators available and things like that. But it is getting worse. I did add in the amount of PPE we have available for any who might be interested. For the most part, it's available, but on our call this morning, it was discussed that we should be operating as though we have a shortage, just so that we don't end up in a shortage. I hesitate to even pull this up, but I mean, things are just getting worse. So Central Michigan as a whole, this is kind of our 7-day average. Last week, we had 316 per million per day. Now we're at 518 per million per day on average. And our percent positivity is around 12.3%. District 10, the average is 470. It was 277. And percent positivity went from 10 to 13. Mid went from 456 to 700 on average. Percent positivity went from 7 to 10. So things are just really increasing, and we're hopeful that as we have less exposures in the community with people not congregating as much, things will decrease. But concern with the holidays, what might happen. So this is some newer guidance. I provided the full report link here, but this is from Children's Hospital of, I think it's of Pittsburgh or Philadelphia, or it's CHOP. They're a very renowned pediatric hospital, but just things to think about as you're considering whether or not to go to remote education. Are you having a hard time maintaining all of your safety protocols? Are you having issues with compliance with masking or distancing, or people reporting their symptoms, coming to work sick, coming to school sick? How effective is your collaboration with local public health? And I would throw into that, how effective is local public health right now? And because of our workload, we're not as able to keep you informed of positive cases and do contact tracing and help you with those things. You're doing a lot of that. You're helping us right now a lot more than that. How quickly is the disease spreading and the test positivity accelerating? Pennsylvania has been looking at a positivity rate of 9%. I know these every state and almost every county, everybody has kind of their own benchmarks and thresholds. And honestly, there really is no science or evidence behind them. They're kind of our best guesstimate, but that is what they use. But we definitely, we're on the upward slope of the curve at this point in terms of acceleration. Do you have evidence? And these are what I think are important. Are you having in classroom transmission? So are your safety measures working? Has there been evidence of transmission in your schools or other schools in your region? So despite all your hard work, is the higher rates in the community causing spread in your schools? Are there populations to consider for prioritized maintenance of in-school instruction? So if these are all on the negative, then are you thinking there's people you need to prioritize for in school? So if you're looking at your K through 8, should you consider having those who have challenged learning abilities, or parents that can't stay home with them, or kids who don't have internet stay in person and really encourage others to change to remote. So this is just some good steps to think through. This full report really is very, very interesting, and it's not very long, and it's very new, so it incorporates a lot of new information. On the last page, there is a graph with some benchmarks. It hasn't been updated since August, and so again, I kind of hold those a little bit suspect just because I have a hard time with looking at absolute numbers rather than the whole picture. So I just share these again, just so you have them available. Again, due to our increased volume, we may not be able to reach out to every individual or reach out to them in a timely manner. So I just share some resources that we have if you need to communicate with staff or students about quarantine or what to do if they're positive. And then this answers some frequently asked questions. And this has been in my last two presentations, but I just share it again. The other thing, I forgot to put this in here, but earlier this week, we also sent out a letter to all of our employers. And I would assume it went out to our schools. I guess I didn't even think of that. But because of our caseload, we are no longer providing clearance letters to people for their employers, clearing them to return to work after isolation or quarantine. That letter clearly return to work after they are ill or positive and after they've been exposed. And it also had a lot of frequently asked questions addressed on there. If you did not get that and want to get that, or if you have any questions about that, let me know. But that was something that our nurses got calls on numerous times a day. People saying their employer required that, and it was just something we felt we could educate employers on and save our staff a lot of time that they could put towards case investigations. So, so I will open it up to questions at this point. And we'll see, hopefully we can have a good dialogue today.
Okay, Dr. Morse, we have the first question comment from Ryan C. says, work from home, it's okay to go out of state or out of the country as long as they can do their job from there. I don't know, I put some sarcasm on that, but I don't know if Ryan intended it to be funny or not.
This is Ryan. I mean, it wasn't really meant to be funny. It's, my OSHA guidelines are telling us that, they can work from home. However, we had teachers go ahead that Sunday night and book tickets to Cancun because they feel that they can work remotely from anywhere in the world. So I guess I was hoping to get clarification on that.
Well, I know that, my health departments have had alternate work policies for quite some time. And we have very specific rules with our work from home policies. And so just because they're working from home doesn't mean that they're not still your employee. They still need to be available to report to work if needed. If they have an issue with their internet, they'd have to be able to report to have that fixed. So, again, they're still your employee. You can still have requirements on them. They have to prove that they're still doing their job. So I don't know. Again, the point of it is so that they're not in spreading the illness. But yeah, I know we have very specific work from home policies that really are quite specific as to what your expectations are when you're working from home.
Okay,
next.
Oh, sorry, Brian. Next question, is Central Michigan Health Department's position still schools open K through 7 if they are able?
So that is our, It's really the same as it has been. Look at risk versus benefit. I guess the point I'm kind of beating around the bush at, just because it breaks my heart to say it, is one of the newer risks that's getting worse and worse is that we as a health department are not able to guarantee that we're telling you about every case you have. So you need to feel comfortable with your staff and your families keeping people home when they're sick, letting you know if they test positive, staying home if they're positive, staying home if they've been exposed to somebody, knowing that that somebody might be sick out there and may never have told their close contacts, and we don't know who they are and haven't told their close contacts. So you could have people that have been exposed working. So those are the things I just want everyone to realize, that could be the situation. That we can't guarantee that we're keeping cases out of the schools. But that's the same for everything else going on right now. So the people going into work in grocery stores and, every other facet of life right now. And so, if people go grocery shopping or go anywhere else, that's pretty much the standard quo right now.
Okay, we'll move on, Dr. Morse. So Jennifer Verlegger says, do you have any update on travel advisories, specifically for travel within the U.S.?
It is unchanged. So it recommends that if you do anything high risk, that you stay home as much as possible for 14 days. And high risk is traveling anywhere with high levels of COVID. It's not specifically stating if you go to X, Y, or Z location, you must quarantine. So I haven't looked at where we stand compared to other states right now, but it's likely that we're as bad or worse than a lot of other states. So it'd be hard to force a quarantine on somebody if they're traveling somewhere just as bad as Michigan. But just as previous, that is a employer decision. If you want to have those policies, there's no specific change.
All right. What quantifies an outbreak in a school? Number of infected individuals?
So it is 2 or more cases within 14 days that have been within the same area of the school or after school activity or gym or somehow related within the school and have no other exposures to COVID to have caused their illness.
Yeah, I know that there is some confusion as to why, with cases rising in schools, they're not reported as outbreaks on the state website. But what you're finding is that the cases aren't either coming from inside the school, correct?
Correct. Yeah. So what happens is we do get quite a few cases in people that work or go to school. And a lot of them, they'll have, a family member that's been sick, or they went to a birthday party, or they're on a travel soccer team, or, different things like that. So those are what we call community acquired cases. So they're getting COVID outside of the school and they just happen to be a student or a teacher. So those are not school-acquired cases, but then they may infect a classmate or a teacher. Then that is when it becomes a school outbreak. So really, when you have 2 or more cases, so if you have 2 cases, it's an outbreak. Really, only one of those 2 cases was school-acquired, yet we call both of those cases an outbreak. But yeah, the vast majority, so 85% or more of our cases that have been reported in people going to schools or working in schools have been acquired outside of school. And the people that are most at risk of getting COVID are people that live with someone who has COVID. So that's typically what's happening is somebody gets COVID somewhere and then everybody at home catches it, and some of those people happen to go to school or teach. So hopefully that makes sense. And I can provide the link to the website that has the official definition for a school outbreak if you're interested. Let's see if I can find it.
Okay, we'll move on. The next question, with the issuance of your statement today about documentation and contact tracing from the Public Health Department, significant delays in the return of test results, and the local hospital sharing with us that it will likely be early to mid-December before they expect testing capacities to return to normal, does this impact decisions about returning to school for pre-K through grade 8 students? Contact tracing is a key safety measure, and if this cannot be done properly, I have concerns about this and a return to in-person learning.
So I'm guessing whoever's asking that is not in in-person learning currently. And so I know there's a lot of efforts to increase testing capacity, but we don't know. I really hate to make judgments on the future before the future is here. So I would have to say, let's discuss that when it gets to be closer. So if whoever's asking the question is on remote learning until December, I would say let's revisit it then. I would say the measures we're taking now, I don't know that 3 weeks is going to have a huge impact given that we have Thanksgiving right in the middle, but we'll have to see. So I'm being intentionally vague on that one.
Okay, next question. Of the 261 cases in education, do we know the percentage who are in the high school?
No, and like I said, when I asked my nurses for that data, I didn't think to ask them to separate out the ages. If any of my nurses are on the phone, if you want to chime in, if you have an idea about what percent you think might be high school versus elementary, that would be great, but that was an oversight on my part.
This is Becky from Clinton. I don't know a percentage, but the majority of my cases are elementary, middle school, not high school.
This is Jen from Aranac, and the student cases on mine are all high school, and I would say probably half of the teachers are high school and half are elementary or middle school.
So I think it's just going to vary. I think Becky at Clinton might have a lot of, and she'd have to correct me if I'm wrong, but a lot of kiddos that have parents that are healthcare workers that may be infecting their young children. If I'm remembering correctly. So we just have different situations in different places. But I will try and get that information next week. Of course, next week might be a bit different since our high schoolers will not be in person.
And next week, Thursday is Thanksgiving.
Oh, yeah.
So
Yeah. Don't call in next week, guys. Sorry.
So moving on to the next question, Dr. Morse, can you answer the question of how accurate this data is? If younger students are transmitting but not showing symptoms and getting tested, but their parents, then that is not considered a school case, correct? Just curious how and if we really know how much the younger students are transmitting. Thank you. So Brandon, I don't know if I read that correctly, if you want to hop on and ask.
No, you did. It really comes down to, we talk about, obviously, the kids' symptoms and tests seem to be a lot higher at the high school. I guess my concern is I don't know if we really know how many younger are contracting it and transmitting it. So I guess I'm asking that question so that I can know and say with certainty when we say it's more of a high school issue sometimes or older kids issue. I guess how certain are we?
So far, all of the studies they've done on like household studies and other studies, the majority of it has shown that kids don't seem to be a major source of transmission. Younger kids don't seem to be a major source of transmission or asymptomatic sources of transmission. There's always some studies that seem to contradict that. So again, a lot of the cases we do get have a contact outside of. My feeling is if asymptomatic younger kids were a big source of infection, we should be seeing bigger outbreaks within the elementary schools or within their families at home, which that is one concern, is that some of the increases in cases in the community in parents and grandparents is because of asymptomatic spread in young people. But I would expect, just like with influenza or other upper respiratory illnesses, that kids play a huge role in spreading. I would expect to see huge amounts in our elementary schools if kids were a big asymptomatic source. We'd see a lot more illness in the adults especially. And since we're not really seeing that, that is why I tend to believe the previous data where they've studied households and families with kids. Certainly, we don't know for sure. I mean, it's hard to be definitive about anything. But that's what gives me a bit of reassurance, is that we're not seeing huge absenteeism or huge illness rates like you would with other illness. Of course, we're using a lot more prevention than we would during the flu season or things like that. But that's my rationale for it.
Okay, I think you may have answered the next question with your last statement. Lisa Seeley says, I've heard that transmission for elementary students is low to non-existent. Do you have any data or sources that show this sort of data, studies, or information?
So it's certainly not non-existent. They do seem less likely to catch it and less likely to spread it, but they certainly can do both. I'm trying to find my chat box, and I don't know why on earth I can't find my chat box, because I can post a wonderful source of, it's a resource that shares tons and tons of data about school kids and all kinds of school topics. But I don't know why I can't find my chat right now, because I'm trying to post the definition of a school outbreak and I can't find my chat.
Is it up at the top right? Mine moved from the bottom center to the top. I don't know if you see the icons up there, top right.
No, the only thing in the top right is my picture. So, oh, I see it. I got it. I think. All right. So, okay. So I will post the source that has a lot of data about this in it. And I'm also going to post the definition of a school outbreak. So I'll keep up with questions, hopefully, as I do this.
All right, I'll throw this one at you, Dr. Morse. In your opinion, do you see athletics and extracurricular activities returning on December 9th, like the HSAA is suggesting?
I have no idea. So as public health, we have felt that the rates have been too high to have athletics all along. So that was our opinion and will likely continue to be our opinion. But again, I'm not one to try to predict the future because there's just too many variables.
Okay, is it true that the health department will no longer provide quarantine letters to people? We have been using this as a required piece of information for using COVID leave time.
That is correct.
So we're asking that schools follow the dates of onset of symptoms to determine, right, Dr. Morse? I know that there is some challenge with people having some kind of a report of their results. For example, I had an individual call yesterday and she was called about her results but didn't receive her actual results to be able to have the date and have verification of her positive case. I encouraged her to call the place again where she did get her results to see if there was a lab patient portal for her to log into so she could have a record and then they could determine dates from there.
Again, we sent out a letter to all, I think at least with District 10, Janine, that Gov delivery document explaining all that went out to everybody, including schools. But we did send out a letter to employers about that change. So if our educators and school administrators did not get that letter from us, please let us know and we'll send it out to that listserv about us stopping providing letters about release from isolation and quarantine.
Dr. Morse, this is Melissa from Central. I just sent that out to all of our schools while we've been on the call, to everyone that I normally send the weekly school calls to.
Great, thank you.
Dr. Morse?
There is a challenge too with regard to emailing because our Gov delivery list and our contact list don't necessarily have the emails of everybody who's on this call because people have been added to this call, and so they're not on my contact list. So if you did not receive the letter from the District Health Department number 10, feel free to email me, or you can email info@dhd10.org and make sure you get the letter.
We'll send those out, or that letter out, to schools as well.
Thank you.
Okay, so next question, would you be willing to share the policies, the work from home policies with administrators? So they can develop their own, I think?
So I guess that would be up to my administrators. I'll ask my administrators.
Okay, Jason Kennedy said safety should be the top priority in making recommendations. Next question, Dr. Morse, what is the data point that indicates that hospitals are dangerously close to being at capacity? I think you showed the state at 74% of capacity. When should we begin to factor that data point into school decisions?
I honestly have no idea how schools are supposed to use that data point. I don't know how that plays into it unless we feel that schools are causing community transmission. So if we feel that schools are why community rates are going up and schools are causing the elderly or the high risk to get sick and go in the hospital, and we feel like, gosh, we need to close schools because it's making people have to go to the hospital. I personally don't really feel that. I feel that the community is making people in the school sick. Whereas like with flu, we know that kids are a big cause of spread. With this, we don't really see that. The legislature put in a bill that was just a data point you had to track. If the health officers are on or anyone's on the call that knows if that is something that they have to actually, how to use that data point. But, unless we know for sure that kids being in school is making people get hospitalized, I really don't think there's anything to do with that data point other than just as an indicator that, yep, there's a lot of COVID in the community and people are getting really sick.
Yeah, Dr. Morse, this is Steve. I would add, I completely agree with you in terms of the data point. It would be as if, people being in school was ending up with hospitals. I almost look at it as the opposite. If we were to make K through 8 virtual, there's a potential that will hurt hospital staffing because some of those staff will have to stay home to care for their kids.
Okay, moving on. Ryan C. has a follow-up comment. He said, I did get an opinion from Thrun, and they stated that we must allow them to teach remotely, even if it is out of state or out of the country. Quote, we have to let them try, is what I was told due to my OSHA guidelines.
Yeah, so I'll just follow up. I'm not an employee expert, an employment expert, or, really familiar with education rules or anything. So that's why I provide that number if you have questions for my OSHA.
Okay, next question. I'm hearing positive COVID parents state that their child's quarantine date would not start till after the 10-day isolation, which is correct, but also takes into effect their symptoms as well, and that they have to be fever-free for 24 hours before their 14-day quarantine starts. This should be a situation where the positive parent is not isolating from the family, just looking for clarification.
Yes, so if the parent is ill and positive, their isolation is at least 10 days from the onset of symptoms, and they must also be fever-free for 24 hours, and they must have improving symptoms. They don't have to be gone, they just have to be improving. And then if that child, which happens with a lot of little kids, the child was not able to be isolated or the parent wasn't able to isolate away from that child, the parent, the child's quarantine is 14 days starting after the last day they were near someone contagious. So the parent is no longer contagious after those 10 days and 24-hour fever-free and symptoms improving. So the child, in essence, then is in quarantine for 24 days because they weren't able to be isolated away from that parent. Ideally, the parent shuts himself away in a bedroom and another healthy adult takes care of them. But we have a lot of single parents who just can't do that. Or it's a 2-year-old or, a young child who just can't go without seeing their mother, different situations. So yes, that is correct in those situations. And I'm reading the next one, question about a report of a spike 10 days after the Canadian Thanksgiving. And then what do the models project for us following our Thanksgiving? I don't know, but I think we all expect there to be a spike, despite, encouraging people to stay home and not travel. So again, it's just a matter of waiting and see what happens.
All right, Dr. Morris, next question. If we close our JK through 8 school, but provide structured childcare, who can utilize this service? Is it only essential workers?
And I don't know that answer. I just know that was an exception in the epidemic order. I know that was more formalized in the spring when there were, some major issues. So again, I'd follow up with MDHHS or Lara, unless anyone else on this call knows the answer to that. My assumption would be it'd be similar to the spring where it was just for, I believe it was just for healthcare workers at that time.
Dr. Morse, this is Kim Blazek at Lake City.
Yeah.
So in response to that question, we checked with licensing on that as well, and we were told that it is for essential workers, but we could not ask for documentation. So if a parent comes in and says, I'm an essential worker, it's not for us to determine if they are or are not, and then we take the child. So that's what we've been told.
Huh.
Okay, Stephanie Larson says, I feel like it's a high percentage of high school kids, not so much elementary or middle.
So
talking about cases.
Yeah, that's one of our nurses at Central Michigan. So
okay, and Scott Karapchian says that we did receive this letter last week, so that's good. Dr. Morse has provided lots of links, a few links to data and guidance. And then Justin is asking, who at Thrun said that? Backing up to Ryan, I think Ryan C. made that comment. Ryan, are you still on the call? Ryan C.?
Yeah, I'm sorry. Could you repeat that?
Justin is asking who at Thrun made that statement, and I hope I'm saying Thrun right. Is it Thrun or Thrun? I'm not sure.
I work with Tim Gardner.
And this is Marcus. I just want to be sure, Marcus Cheatham from Mid-Michigan, that I understand what you're saying. Was Thrun saying that you have to give teachers the chance in K-8, the chance to work from home before you have schools open for in-person learning?
No, I'm saying if you close any school, so we ended up closing K-12, but if you're, required 9th through 12th grade to close, as we were, they can remote work from anywhere they want to, as long as they have connectivity and the ability to do their job. So, they can take off and go to Cancun as long as they can meet their requirements.
Okay, thank you.
Yeah, I guess the disheartening part for me is that, you have people who are working hard, working from the classroom still sometimes. If we would have required our K-8 teachers to stay in session and you got your, 9th grade colleague on a beach in Mexico, it just doesn't seem right. And then, what happens if they come back and they're in a situation where they were in a hot spot? Now do we have to quarantine them and then they get an extra 14 days off? It's frustrating.
Yeah, I mean, my reaction is public health doesn't have a dog in that fight, though. But yeah, I see your point for sure.
So Dr. Adam Bain says, I was just going to say that Dr. Bain says this is related to the MIOSHA order from October 14th. Thrun held a webinar on this yesterday. Go ahead, whoever jumped on.
Oh, I was going to say that, like, weren't schools allowed to make their own travel policies, though, too? Like, obviously they can work from any place, but if they're planning on coming back, I thought that schools could basically say this is a policy that if you've been out of, country or even out of state, like, you can require them to quarantine or whatnot.
I think the issue, Jackie, is that if they go remote for 3 weeks, or they decide it's okay to come back to in person, and now you have half your staff that has to be quarantined for 2 weeks, what are you going to do?
True.
Okay, there's another question. In our district, of the 12 positive cases, 6 are elementary and middle school, with others that are high school and staff members, including transportation and athletic coach. This argument is tough to make in our community right now. Any help with this?
Do you mean the argument to stay in person, or could you clarify that, Jason?
Yeah, so just the idea that transmission in early childhood education is not as much as it is in the high school. In fact, our cases, we have a kindergarten student with it. We have a student in the elementary who passed it to an elementary teacher. So it's hard for that argument to hold a lot of weight in the community right now, because our numbers are suggesting that it really doesn't matter if it's an elementary student or a high school student. So just looking for some help on how I can educate our community, how I can help with this, when the data, although limited with 12 cases, suggests otherwise in our community right now.
Yeah, and it is really challenging. And there may be schools where you are going to see more spread, simply because of, maybe there's personal behaviors of certain students or teachers, or just bigger classes, or, not saying that's the situation here. And you'll have certain individuals that might create more virus or maybe more symptomatic. And so that's the problem when you have low numbers, is if you have a couple of odd situations, it really throws everything. Sorry. I know one of the big issues right now is fear. I appreciate the MEA statement. Well, I appreciate the issues from the MEA statement that came out Sunday night. And I know that likely caused a lot of concern. And I know, I mean, right now we are in a situation where there is a lot of uncertainty. We likely have a lot of asymptomatic infected people everywhere, school included. We have people that may not be getting tested or able to get tested. We're really we're at a point where you could go either way, and it's really hard for me to say that, but we don't have there's not a lot of proof that we're facing a horrible danger zone, but are we missing the danger zone because we just can't find it because we're too busy to see it? So I hate to say it, but we're at a point where really doing what's best for your community and your kids and families is the best thing to do. It's really, really difficult. And I know everyone has different situations right now. My biggest fear are for the kids who just aren't going to be able to learn at home, don't have internet at home, or whose parents can't really afford to stay home with them. And so again, before you're forced to go remote, to think about maybe doing like a partial change. But in terms of trying to reassure people, I don't know that we can necessarily convince them that everything's okay at this point.
Thank you.
Mm-hmm.
So next question, if K through 8 school related cases are minimal and isolated, so they're non-school outbreak, do you recommend staying in session in the immediate weeks following the holiday season until an outbreak takes place?
So again, right now, I don't have a great recommendation. It's really what's best for you and your community. I don't know. Does any health officer want to jump on and help me here? I'm struggling here. After the holiday, to close preemptively, I don't know that that's necessary, but you can consider it, or at least warn your parents that might be likely so that they're at least prepared for it. But again, we're kind of on this precipice right now, where I'm not going to flat out tell you have to shut down, but you may need to start looking at some ways to depopulate, or
Well, Doc, the other thing that I would add is, this is a good time for schools in terms of your messaging as well, as because we know the kids are going on break soon, and maybe you can help educate the parents on the proper behaviors over the break, and you can indicate that fact that, if we see a spike once we get back from the holidays, there is a potential that we're going to have to go all remote. So do your part to help us in keeping school in person. Because I think we were looking at, weren't we, Doc, if the expected bump based on Thanksgiving break would be around, say, December 5th through the 7th, sometime in there. Wasn't that what we were thinking?
Well, we'd see 1, 2, 3, 4, 5. People would probably start getting sick around the 1st through 3rd, and then their test results would probably start coming in around the 4th through 7th. So would be the guess.
All right, next question. If a staff member tests negative and wants to return, do they have to stay out 10 days on quarantine? The staff member is asymptomatic.
So people that are asymptomatic and getting tested, okay, so if it's someone who's been exposed, if they're a close contact, they have to stay out the full 14 days no matter what their test shows. If it's someone who's getting tested because they have a procedure coming up or something and they're just getting tested and they have no symptoms at all, they never have to stop working. But if someone's exposed and they're close contact, the test results, a negative test result does not get you out of quarantine. If that's not the question, please.
So, yep. So this is Jennifer. This is my question. The staff member took a test because there was a runny nose. Took the test, precautionary, has to stay out 10 days. Thinks it was allergies, but is asymptomatic now after being out waiting for test results and is negative.
So if it's just a runny nose, then they don't. I am hesitant to bring this up because this is a real downer. But just so you're aware, there is a new law that was passed October 22nd, which states that if, let me see here, and this is the legislators you could thank, an employee who tests positive for COVID or displays the principal symptoms of COVID shall not report to work until all of the following conditions are met. And it's 10 days have passed, no fever, and principal symptoms have improved. And the principal symptoms are fever, shortness of breath, uncontrolled cough, or 2 or more of the following, which is abdominal pain, diarrhea, loss of taste or smell, muscle aches, severe headache, sore throat, vomiting. We're trying to get it edited so that just having symptoms does not cause that to happen. But I will copy and paste that into the chat box. It's the House bill version of it because it's easier to read, I think, than the common law version. So if they had a sore throat and a runny nose, then by law, they're supposed to stay out the 10 days.
Thank you.
Mm-hmm.
Okay, next question. I'm curious as to the Thrun statement, as I do not recall hearing that yesterday. I also have to deal with this as it did occur in the spring and would prefer being avoided this time around if possible.
So I guess I just encourage people to seek legal counsel on those questions. Because again, that's out of the public health wheelhouse.
Okay, are there any more questions from anybody on the call that you want to either put in the chat box or unmute yourself and ask directly? All right, well, Dr. Morse, I think you've done your part again. So going forward, are we not having a call next week? Are we moving it to a different day because of the holiday?
Well, I know that at least my kids' school, they only have school Monday and a half a day on Tuesday. So I think a lot of the schools have a pretty short week next week. My feeling is to have no meeting next week. If you guys have questions, you can give us a call or email, and then we'll pick up on the 3rd as usual. If anyone has thoughts about that, feel free to chime in or let us know. All right, Steve voted for the group. Sounds good to me.
Thank you, Steve.
All right, so we'll probably send out an announcement then if there's a significant. Yes, so we will, if there's any major updates, we will get a message out to the schools next week. And again, if you guys have questions or concerns, just email or call. All right, you guys, hang in there.
Thank you, everybody.